after the Arts Build mission to build community through the arts. To learn more about the shared services that we offer our community arts partners, please take a look at the shared services portion of our website, and I'll put that in the chat here in just a second. Artsville currently facilitates these services for our community arts partners, the recipients of our mission support grants. So you'll find, if you're interested in that, you'll find more information on this page. If you missed Tuesday morning session with HR Biz Solutions about navigating, renewing, or creating an employee handbook, we invite you to view the presentation through the Arts Build YouTube page. It's available there. But tonight, we will hear from Chris Ramsey, who is the principal of the Chris Ramsey Agency and a healthcare advisor. So tonight's talk centers around the Affordable Care Act and marketplace enrollment for the arts community. Our hope tonight is that you sign off of this meeting feeling better equipped with pertinent deadlines and information about coverage plans to help you make the best decisions for your needs. So with that, I would like to introduce Mr. Chris Ramsey.
Hey, Amy, thanks a lot. Thanks a lot. And I'd like to thank James McKissick, the CEO of Artsville, for inviting me to come on. As Amy said, I'm Chris Ramsey. I'm the principal agent for the Chris Ramsey Agency. I've been in healthcare for 30 years. 24 and a half of those years were at Blue Cross Blue Shield of Tennessee. Also, I've worked in the nonprofit sector. I was the CEO of a local startup nonprofit here in Chattanooga for about 1.5 years. I went and got my health insurance license in 2018 and opened my agency. And now I'm glad to serve. I'm licensed in Tennessee, Georgia, and Texas. I have a business partner, LaQuentin Jenkins, that's out of Texas. Also, one of my partners here locally, she's an independent licensed agent. Miss Valencia Brewer is part of my team as well. And we look forward to even supporting you guys in terms of your health insurance need. What I like to do, and I have my timer on because I get very talkative. So I got my timer set at about 15 minutes because I like to hear from you and have some questions answered where we could do a Q&A before we have to cut off. But what I'm here to talk about today is called the Affordable Healthcare Act, or the Affordable, or called the Marketplace. Some of you all have heard of it. It's an insurance program. People refer to it as Obamacare. I'm here to let you know that this is great insurance for individuals who don't have an insurance plan that cover all of your health insurance needs. There are 4 carriers this year that are part of the Marketplace or the Affordable Care Act here in the Hamilton County area. So you have Ambetter, which their parent company is called Centene Health. They've been around for over 60 to 70 years. They're real big into Texas and out west. Of course, you have Blue Cross Blue Shield of Tennessee. You have Cigna Connect, which is part of Cigna Healthcare Insurance. And then you have United Healthcare. So these are 4 reputable companies that have been around for years that are currently offering products on the marketplace. I'm going to start some screen sharing because the first thing that you need to understand with the marketplace is that it's based on a couple of factors. One is your income level. And when I say income, I mean your taxable income. And the chart that I put up in front of you is called the Federal Poverty Level Chart. And of course, this is the one for 2020. And the way the law is written, if you have a household income between 100% of the federal poverty level and 400% of the federal poverty level, the federal government will help pay for your health insurance premiums. So if you're a household of 1, and you actually make right at $12,760, then you're right at the 100% of the federal poverty level, and you can actually go all the way up to $51,000 in order to qualify for subsidies. Of course, the lesser amount you make, the more the federal government will help pay for your subsidies. The more you make, the less help you will receive. if you fall outside of these limits, so if you are below 100%, the way the law is written, you can actually still purchase the insurance on the marketplace, but you will not receive subsidies from the federal government to help pay for your premium. On the other hand, if you're above the 400% level, again, you can still purchase health insurance on the marketplace, but you would not receive any type of financial subsidies. So in a lot of cases, you may have heard the term in the political arena that states need to expand Medicaid. And the reason for that is because the people who fall below 100% of the federal poverty level, if they're a single male, they don't qualify to enroll in TennCare, which is the Medicaid program, but also they don't qualify to receive subsidies on the marketplace. So they're kind of falling between the cracks in terms of getting affordable health insurance. But I wanted to share this chart at first because as you think in your mind, based on your household size, and these are people who you claim as dependents. So if you and your husband live together and y'all file taxes jointly, then you're a household of two. In order to determine your insurance and how much you qualify for subsidies, the income is based on household income. And
hey, Chris,
yes.
I hate to interrupt you, but there's a little bit of static on, James and I are catching some static on your end. Can you repeat that part about the husband, the spouse?
Yes, so a husband and spouse is considered a household of two. So it's based on how you file your taxes. So if you file jointly and there's two in the household, then it's looking at a total household income. It's not just looking at your individual income, but it's based on your household income. Now, these particular plans, you can have, you can't cover your spouse and your dependents. And so this thing I wanted to show you, I thought it would just be real quick in order to do this, is to just pull up my tool. It's called my quoting tool, so you can see how this actually works. Oops, I meant to hit share. Okay. Okay, so if we let the quoting tool, and again, just to go through this real quickly, if I live in 37421, I'm 35 years old, I'm a female, and let's say I make $25,000. And this is my estimated household income for 2021. So if you notice up in the upper right-hand corner, it says that I'm eligible to receive a tax subsidy or a tax credit from the federal government in the amount of $294 a month. These plans come in 4 different metallic levels. They come in bronze, which is what I call a catastrophic high deductible health plan. They come in silver, which in aggregate will cover 70% of your healthcare costs and you will be responsible for 30%. A bronze is 60-40. A gold will cover 80% of your healthcare costs and you will be responsible for 20%. And a platinum will cover 90% of your healthcare costs and you will be responsible for 10%. So let me show you what a bronze plan looks like. This first bronze plan is offered by Ambetter, and also you see one right below from Blue Cross Blue Shield, Tennessee. The amount in red that has a line drawn through it is the original cost of the plan. But with your tax subsidies, with your help from the federal government, your monthly premium would be $43 for the Ambetter plan. Now, this is a household of one. Keep in mind you may not be able to afford to use this plan because you must meet a $8,300 deductible before your benefits kick in. Now, under all health insurance plans, all of your preventative care is free. So you pay zero in order to go to the hospital, go to get your annual exam, to get your mammogram, to get into your preventative care. So I'm gonna scroll down to the first silver level plan. And then that way you'll see a plan that you could probably not only afford, but it will be cost effective for you to use.
Hey, Chris, you're breaking up pretty bad.
Yeah.
Let me jump off of, I'm gonna jump off for a minute. I may be having some computer problems, but look at the Cigna plan. That's a silver plan, and it's $131 a month. And you actually, let
me hold on for a second. Let me do something.
With the silver level plan here, it's $131 a month. You have a flat dollar copay to go visit the doctor, and you have a flat dollar copay for generic drugs and for specialty. And your annual out-of-pocket maximum is the most that you will pay out of pocket on this plan for the year if something was to happen to you. And after you reach your out-of-pocket maximum, everything is covered at 100%. I'm gonna stop sharing. I wanted to show the screen, but I'm gonna jump on my iPad because I think I'm having some computer problems on my Surface.
Whatever you did, it's a lot better now.
Mm-hmm.
Well, I jumped off of, I was having some problems on my Surface, so I'm on my iPad now. So again, I can show those. I could do a Zoom call with individuals, but what I wanted to make sure that you get across is that everything is based on your taxable household income. Whenever the federal government, now the thing about it is that even though sometimes you may know what, you won't know what your exact income is going to be for 2021, the thing is that throughout the year, you can update your income throughout the year. Because again, looking at that federal poverty level chart, your premium, your subsidies is going to be based on the amount of income that you put in your application. And at the end of the year, at the end of 2021, the marketplace will send you a tax form that you will be required to submit with your taxes in order to do that reconciliation. So you want to make sure that the amount of income you put in your application is in the ballpark, range with what you think you're going to make at the end of the year. And again, if you make more money than you put in the application, so the example that I showed was $25,000, but let's say you make $40,000, but throughout the year, you never did update the income in your application, and you actually ended up making 40. So when you filed your taxes for $40,000, they're going to say, well, your application only had 25. So you're going to end up owing additional taxes because your subsidy, the financial subsidy that the federal government was giving you, was based on $25,000. So what I advise my clients is that if your income fluctuates throughout the year, whether it's monthly, whether it's quarterly, we need to make sure that it's in the ballpark with the amount of income that we included in your application. So again, the process, the way it works, if you schedule a meeting with me, it would take at the longest, if you have all of the information you need, we would do some kind of talking on the phone, some pre-screening. So that way, when you come, even if you send me your information, or if you text it to me, I can actually enter your information, and within 1 minute, I can have a quote turned around to you. And if you're interested in knowing more details about that plan, I can download a summary of benefit document that I can email to you as a PDF. You can look it over. Whenever you're ready to enroll, we can jump back on Zoom or we can jump on the phone, and it'll take another 15 minutes to go through your enrollment application. In order for you to meet with me, you don't pay me anything. You don't pay me, it's free. The way that I get paid is that when I help you with your enrollment, then I'll receive a commission from the health insurance company. So even though some people say, well, Chris, how can you help me for free? Well, the way that licensed agents work is that they get a commission when they help with any type of enrollment. But you're not going to see a lot of advertisement regarding the Affordable Care Act, you know, the way the political climate is. But this is great insurance, especially if you qualify for a subsidy. If you qualify for a subsidy, even if you have a family, I have clients who family members, the kids are on TennCare, but the parents don't have insurance. And as you know, when you get on the airplane and they start having a little turbulence, the first thing that they say is you got to put on your mask before you can help someone else. So I encourage you that if you are uninsured, you don't have insurance, take a look into the marketplace. If you make between 100% of the federal poverty level and 400% of the federal poverty level, you have an opportunity to get some affordable health insurance. The deadline to enroll for 2021 is December the 15th. So we have less than 30 days. December the 15th is the deadline for you to enroll for the marketplace insurance plans, and the plans will take effect on January 1st, 2021. Okay? I know that was kind of quick, but I would like to, Amy, maybe to open up and just do a Q&A, and then that way I can respond to people's questions versus you hearing me talk the rest of the time.
Okay, and I think the way we're set up, folks are free to ask questions. You simply have to unmute. Let's see. Any questions for Chris in the room?
Let me say another thing, because I think it was Mia. These plans are considered essential health benefit plans. So they cover the 8 different categories that a health insurance plan is required to cover. So you will have doctor office visit coverage, both your primary care and your specialist. You will have prescription drug coverage. You will have coverage for x-ray and lab and imaging. You also have coverage for hospitalization, whether inpatient or outpatient. You have mental health and substance abuse coverage. And also you have over 74 preventative health screenings that's covered. So you may run into plans that they're calling themselves insurance plan, but they may not include some of the categories that's required by law. It's called the essential health benefit categories that the law requires that all health insurance carriers cover. So if you hear these discount savings programs, but you may not have hospitalization coverage, or you may not have a prescription drug coverage. These plans on the marketplace will cover all of your essential health benefit. If you're a female, it covers maternity. All of your well baby exams are free. And of course, you have coverage for your labor and delivery. So these plans cover everything that's required to be covered under health insurance plans.
Hi, Chris. I actually have a question. Can you hear me?
Yes, I can.
Yeah, so before you were talking about like the different levels, do you mind explaining that one more time, like the gold and bronze?
I don't mind at all. So a bronze plan is the lowest tier. A bronze plan is what I call a catastrophic high deductible health plan. As you saw in the example, you're going to have a low premium, but you're going to have a very high deductible. And sometimes I get to ask the question, who are those plans good for? They're good for people who are healthy, that may use very little health insurance, because the thing with all of these levels of plans, you get all of your preventative care for free. So if you don't want to pay a lot of high premiums, then you can get a bronze plan. You can still go get all of your preventative care done for free. But the point is that you have insurance in case something happens. So you have catastrophic coverage in case something happens, because the flip side of that, if you didn't have insurance and you end up in Erlanger Hospital with COVID, then they're going to charge you the full retail costs of your hospital stay. And if you don't have insurance, you may have to file bankruptcy. You may have to apply for some type of indigent care. Well, under these plans, you will actually have insurance. So think of a deductible. It's just like your automobile. If you was to have an automobile wreck, the first payment that you have to pay before your automobile insurance cover your wreck is you got to first meet your deductible. So that's what a bronze plan is. A silver level plan is the step above a bronze, but those plans, especially depending on the level of subsidy you receive, not only are they affordable, but you can actually afford to use them. Because in some of the plans, like you've seen with Cigna Connect, you only have a flat dollar copay if you go see the doctor. Given the example that I gave, the young lady who was making $25,000, she had a maximum out of pocket of $1,900. That means if something happened to her, the most she's going to pay out of pocket for that particular benefit year would be her maximum out of pocket. And if she was to reach that amount, then everything else for that year is covered at 100%. I saw a question about unemployment benefits. I thought I saw something in the chat about how do you deal with unemployment benefits for 2020? The application that you would apply for now would be for 2021, for 2021. So if you're still drawing unemployment will count towards your income. Again, in order to qualify for subsidies, if you're a household of one, you have to make a minimum of $12,700. So some people use their base income. Of course, a lot of people have been impacted by COVID this year. They've lost their job. They had to draw unemployment. They got the stimulus check, okay? Some people now are just now going back to work. But the income amount that we put in the application for your household income will be based on whatever you estimate for 2021. And again, it just needs to be in the ballpark. And it's not the once you put it, you can adjust it throughout the year. So you can contact me monthly, or you can call the marketplace and call an 800 number to update your application if you feel that your income is going to change a lot based on what you put in your application. Now, if you have zero income, or if you make below the $12,700 for a household of one, the sad part is that you won't qualify for subsidies. So that means that you will end up having to pay the full cost of the premium, which more than likely you're not going to be able to afford it. Was there any more questions that have come through?
There are no more questions.
I had a question. If you don't sign up by the 15th of December, when is your next opportunity to sign up?
Good question, James. This is the annual enrollment period, the open enrollment. Sign up period is every year between November 1st and December the 15th. The only way that you can qualify throughout the year if you qualify for a special enrollment. And what that means, so let's say if you currently have employer coverage, and then next year in March, you lose your employer coverage. you have a 60-day window in which you qualify for a special enrollment. If you have an addition to your family, that qualifies for a special enrollment. If someone relocate, if they had insurance, they lived in Memphis and they relocate to Chattanooga, well, plans in Chattanooga are different than the plans in Memphis. So they have a 60-day window to qualify for a special enrollment. But if you're here today, you live in Chattanooga, you missed the deadline by December the 15th, you cannot enroll again until next year's open enrollment, which is November the 1st through December the 15th. The website, and I think I pulled it up for a minute, is called healthcare.gov. Healthcare.gov is the official marketplace website that if you want to just learn in general about the coverage, it won't give you the detailed plans like what I was just showing you. The portal that I was showing you is my enrollment portal. That's what I do when I help clients enroll. I take them through the enrollment process and I help them to select the right plan for them. The other thing with these plans is that you have to go to the doctors that are part of the plans network. You have to go to the doctor that are part of the plans network. So once you get past the pricing, you're okay with that, we have the ability to go to the plan's website to find out if your primary care doctor or is your specialty doctor, if they're part of the plan network. Because if you go out of network, there are no benefits. You'll be responsible for 100% of the costs. So it's important that you stay in network for whatever plan you sign up for.
Chris, does going out of state denote going out of network? We just had someone ask, are you covered for healthcare if you go out of state, or is it only in state?
Good question, good question. So some of the networks, like let's say the Blue Cross network, it's a state network, but if you're traveling across state lines, more than likely if something happened to you while you're in Florida vacationing, it's gonna be an emergency. And so emergency care is covered when you're out of state. Now, if you decide that you're gonna live 6 months in Florida and 6 months in Chattanooga, this plan will not travel with you. That qualifies you for a special enrollment to enroll in a plan in Florida. So if you're kind of a snowbirder, or if you like, traveling across the country, these plans aren't multi-state plans, because every different service area offer different plans based on that service area. But if you're traveling and it's an emergency and you have a plan and you enroll in the plan based on Hamilton County, then that emergency care is covered. But you just can't, say I travel a lot, 3 months out of the year I'm in California. This plan will not travel with you. You need to enroll in a plan in California if you have that type of lifestyle.
And Chris, if people wanted to reach out to you about short-term plans, do you do any work with those, or is it just the Affordable Health Care Act?
I do not do short-term plans. I mainly focus on Medicare. So if you got parents or seniors, that Medicare deadline is coming up on December the 7th. So that open enrollment, annual enrollment deadline is prior to the Affordable Care Act. I do Affordable Care Act. Also, I do small groups, less than 51 employees. I know Mill was asking about a small group plan, but a small group, you have to be W-2 employees. You can't be contracted employees. And there is no deadline for open enrollment for small groups. But I do not do short-term plans. I know there are companies out there like Farm Bureau. There may be other companies that offer some short-term plans, but I do not do short-term plans.
Thank you. We got any other folks with questions? Earlier in the chat, Chris, we put your contact information. Do you have a screen that has all of your contact information if someone wanted to screenshot that?
Yeah. Actually, my website is insuredbychrisramsey.com. they can go to the Chris Ramsey Agency Facebook page, or they can go to my personal Facebook page, Chris Ramsey. I don't have a screen that I can pull up with all of that information, but I'll be sure, again, my best way to reach me is on my cell phone, or you can inbox me on Facebook, or you can go to my website. So I'm pretty much an easy guy to get in touch with around Chattanooga. I have an office on Bailey Avenue. It's at 1089 Bailey Avenue in the Bailey Execs. It's right there across from the National Cemetery, the building before you get to the photo doctor building. So I have an office there. Of course, with all of the COVID stuff, I'm gonna take your temperature. We're gonna social distance, but this actually can be done via Zoom. It could be done via conference call. So we don't necessarily have to meet in person unless we absolutely have to, given everything that's going on with COVID.
Okay. Well, Chris, thank you for being here this evening. I know that we've got some comments, some more of Chris's information in the chat. And then, as James just said, we're going to put this recording on Arts Build's YouTube page tomorrow. So if you would like to share this with others, or others who wanted to be here tonight who couldn't be here, feel free to let them know that we're going to post this conversation online. So
Amy, one other thing that I like to mention, because again, the deadline is coming real quickly. So I'm actually I'm trying to help as many people as I can. So Valencia and I, we're working around the clock 6 days a week. I normally take off on Sundays, but probably the 2 Sundays before the deadline, I'll do a couple appointments. Also, every Sunday at 3 p.m. on the Chris Ramsey Facebook page, I do a live Q&A. So it's a combination of Marketplace as well as Medicare, but I'll be doing those until December the 13th. So Sundays at 3 p.m., go like the Chris Ramsey Agency Facebook page, and I spend about 30 minutes just doing a live Q&A. I think I saw Miss Rosie Russell on this particular Zoom call. She was my guest. She's one of my Medicare clients, but we actually take questions, and I try to give out as much educational information as I can to help people select the right plans for them. So again, Valencia and I and the rest of my team, we want to help as many people as possible. So if you need help, if you need a quote, just inbox us. We can text you the information you need. Valencia, can you put that in the chat field, the information that we need in order for people to get a quote? It's as simple as having your zip code, your age of everybody that wants to be covered, the gender, your estimated household income for 2021, and whether you're a smoker or non-smoker. And again, I apologize for my computer. That's the reason why I had my iPad going at the same time, because I was afraid that it was going to start acting up. So I apologize for that. But within a minute, I can turn around a quote to you and screenshot you some information if that's something that you're interested in getting a quote. So you can start shooting requests from quotes of me anytime you want to. Okay.
thank you, Chris. James, do you have anything you need to add, sir?
No, I just want to say thank you to Chris and Valencia, and for everyone who came out. This is great information. I already texted my sister about calling you to sign up one of my nephews. So we appreciate it. This is what we're about. Our mission here at Arts Build is building community through the arts, and we welcome you to our community, Chris and Valencia. And thank you for this information, and thank you all. That's all I have to say. Amy, did you want to close it out?
I was just going to close it out with, again, a thank you, and take a look at our shared services page. We're here to serve the arts community. So anything we can do for you, let us know. So,
well, thanks a lot. Thanks a lot.
Bye.
Thank
Thank
you.
you. Good seeing
Bye.
everybody.
Thanks.
Bye-bye.